What is Aceclofenac? Aceclofenac is a nonsteroidal anti-inflammatory drug, NSAID. Aceclofenac is used for the treatment of pain and inflammation in osteoarthritis, rheumatoid arthritis, ankylosing spondylitis. This drug works by blocking COX enzymes, which produce prostaglandins at injury sites, reducing pain, swelling, and inflammation. Aceclofenac tablet uses. Aceclofenac is used to relieve pain and inflammation in conditions such as rheumatoid arthritis, ankylosing spondylitis, and osteoarthritis. Rheumatoid arthritis. Aceclofenac is used to treat symptoms such as swelling, pain, and stiffness of the joints associated with rheumatoid arthritis. Osteoarthritis. Aceclofenac is used to treat symptoms such as tender and painful joints associated with osteoarthritis. Ankylosing spondylitis. Aceclofenac is used to treat symptoms such as stiffness and pain associated with ankylosing spondylitis. Aceclofenac side effects: abdominal pain, constipation, diarrhea, nausea, vomiting, skin rash, dizziness, visual disturbance, flatulence, flushing, stomach pain, loss of appetite, heartburn. Precautions: avoid it if you have a known allergy to Aceclofenac or other NSAIDs. It is not recommended if you have asthma or a history of asthma in your family. It is not recommended if you have any bleeding disorder. It may cause severe swelling and bleeding in the stomach, colon, and anus. This medicine is not recommended for pregnant women and breastfeeding women. It may cause severe bleeding when taken for a long time. Elderly populations with a history of gastrointestinal disease are at higher risk. It should not be used to relieve pain before or after CAB, coronary artery bypass surgery. It is not recommended if you have impaired kidney function. Use with caution with an initial dose of Aceclofenac 100 mg once daily for mild liver failure. It is not recommended for severe failure of the liver. Aceclofenac dosage. It relieves pain and inflammation effectively. Take it with food or milk to prevent stomach upset. Follow the prescribed dosage and duration to avoid complications. Prolonged use may lead to stomach bleeding and kidney issues. Be cautious of dizziness, drowsiness, and visual disturbances to avoid tasks requiring concentration. Avoid alcohol consumption as it may increase the risk of stomach problems. Inform your doctor of any history of heart disease or stroke. Long-term use may require regular monitoring of kidney, liver, and blood component levels. How Aceclofenac works: Aceclofenac is a nonsteroidal anti-inflammatory drug, NSAID, that works by inhibiting the release of chemical messengers responsible for pain, inflammation, redness, and swelling. Frequently asked questions: what is Aceclofenac used for? Aceclofenac tablets 100 mg are indicated for pain relief and inflammation in osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. Aceclofenac tablets are administered orally and should be swallowed whole with a sufficient quantity of liquid. When should I take Aceclofenac and paracetamol tablets? The usual dose is 1 Aceclofenac 100 mg tablet twice daily, preferably taken in the morning and evening. Take Aceclofenac with food to protect your stomach from side effects such as indigestion and stomach irritation. Swallow your tablet with a drink of water. Is Aceclofenac and paracetamol the same? Aceclofenac is a nonsteroidal anti-inflammatory drug, NSAID, and paracetamol is an antipyretic drug, fever reducer. They work by blocking the release in the brain of certain chemical messengers that cause pain and fever. How safe is Aceclofenac? Aceclofenac and tanoxicam are similar in terms of safety and efficacy, and Aceclofenac 100 mg orally twice daily, is a safe, effective, and convenient treatment for active AS. Is Aceclofenac an antibiotic? Aceclofenac is a nonsteroidal anti-inflammatory drug used to relieve pain and inflammation in conditions such as rheumatoid arthritis, ankylosing spondylitis, and osteoarthritis. How long do I need to use Aceclofenac before I see improvement in my condition? In most cases, the average time taken by this medicine to reach its peak effect is about 1 day to 1 week. For the period you need to use this medicine, please consult your doctor. How does Aceclofenac work in the body? Aceclofenac works by blocking the effect of natural substances called cyclooxygenase (COX) enzymes. These enzymes help make other chemicals in the body called prostaglandins. Some prostaglandins are produced at injury sites and cause pain and inflammation. At what frequency of time do I need to use Aceclofenac? This medicine is usually used once or twice a day. It is recommended that you consult your doctor before use, as the frequency also depends on the patient's condition. Should I take Aceclofenac empty stomach, before food or after food? This medicine should be taken orally. If you take it on an empty stomach, it might upset your stomach. Please consult your doctor before using it. What are the instructions for the storage and disposal of Aceclofenac? It should be stored at room temperature, away from heat and direct sunlight. What is the use of Aceclofenac paracetamol and serratiopeptidase tablets? Aceclofenac paracetamol serratiopeptidase tablets offer combined relief from pain, inflammation, fever, and enzyme activity, making them effective for conditions like arthritis and postoperative pain management.